Welcome back. Botox has been around for 20 years, but while many people know the word, they don't actually know much about the procedure. So what exactly is going on from the moment the needle goes in until the chemicals finish doing its thing? Medical director and owner of Skinworthy, Dr. Cody Hemsworth, put together a crash course for us. Let's check it out.
This is one of the things that keeps people from coming into offices like ours, right? So to be quite honest, there's a little bit of pain, and I'm gonna say like a mosquito bite for most patients. Some patients are even luckier than that and they don't experience any pain. And then there's some patients that have a little bit more than that, or they have a fear of needles. I will tell you an average price for patients coming into the office is going to be somewhere between maybe $300 to $500 for that treatment, and you're going to expect that treatment to last about 3 to 4 months. So I think when you're thinking about these things, you have to be thinking about value, and there's very few procedures or products that is going to give the type of consistent results that we see with using products like Botox. Botox is really just a class of a neuromodulating protein, right? We use this term Botox all the time, but it's really just a protein that we're injecting into the skin, and what happens is that protein gets taken up by the nerve and prevents the message being sent from the nerve to the muscle. So we know that if that muscle isn't getting a message anymore, it's not going to flex the skin, so you're not going to get those fine lines and folds folding so much, so you're actually resisting the wrinkles from forming. It relaxes those muscles, so it smooths out those fine lines that are already there. Because Botox is so well understood, it is very safe. Now, patients usually get pretty scared because they hear the word toxin and then they've heard bad things when they hear this in nature, and it can be really deadly then. But when it's prepared in a lab and then sent to our clinics and used here, it is so precisely controlled that it is extremely safe. The things you're really looking out for is maybe a bruise from the procedure itself or a bad aesthetic outcome, but in the right clinician doing a lot of these injections, it's very consistent.